afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about diabetes and what are the benefits of exercise in diabetes. So it is a group of metabolic diseases characterized by high blood glucose levels, disturbance in carbohydrate, fat, and protein metabolism, resulting from defects in insulin secretion or action of both. So it is commonly referred to as diabetes, was first identified as disease in ancient world, which is associated with sweet urine and excessive muscle loss. Hyperglycemia leads to spillage of glucose in urine, hence the term sweet urine. Regular physical activity or exercise has been found to provide physiological and psychological benefits that can improve the blood glucose control, overall health and quality of life, according to US Department of Health and Human Services. For people with diabetes, exercise is one of the three cornerstones of diabetes management, in addition to meal planning and insulin and medication. Physical activity appears to help muscle cells to take up and use glucose even when there are lower level of insulin in the blood. So although exercise has positive health benefit for people with diabetes, it also carries some potential risk. Hypoglycemia, where microvascular and macrovascular complications can be exacerbated when the exercise plan is not individualized for the person with diabetes or preventative precautions are not followed. So what are the goals? To discuss the role of exercise in diabetes management, to provide information regarding types of activity that can optimize the benefit, minimize the risk of acute complications, and exacerbating the chronic complications in people with diabetes. Objectives: after completion of this one would be able to list the health benefits of regular physical exercise in type 1, type 2 diabetes, and explain how exercise works to lower the glucose, and the recommended screening exams that should be conducted before developing the exercise prescription. Also, the exercise assessment used to develop exercise prescription, component of exercise prescription, benefits of yoga for people with diabetes, and types of exercises that can be carried out by people with diabetes. Also, some alternative exercises for people with diabetes complication and strategies to prevent the hypoglycemia during and after the exercise. So physical activity is like magic for type 2 diabetes. So what are the benefits of exercise in people with diabetes? There is a journal acknowledgement that people have reduced the amount of physical activity that they do on a daily basis. So regular exercise program tailor-made for every individual and undertaken after due fitness evaluation with regular monitoring is an essential part of diabetes management. So there are many benefits like reducing the risk of chronic disease like heart disease, so which can be reduced by 35 to 55% by adopting the healthy lifestyle. And also this is beneficial for people with diabetes because there are 2 to 4 times the risk of mortality from cardiovascular complications which are associated with diabetes. Colon cancer, high BP, hyperlipidemia, stroke, osteoporosis. Also preventing progression of pre-diabetes. There are some randomized clinical trials which have found that lifestyle interventions that included approximately 150 minutes of exercise per week and weight loss of 5 to 7% reduce the risk of people with pre-diabetes from progressing to type 2 diabetes by 58%, plus also controlling the weight or weight management. It also reduces fall among the older adults, reducing the symptoms of depression, anxiety, and it also lifts your mood. Also, there are some additional positive effects like overall blood glucose control and HbA1c levels in type 2 diabetes mellitus. It also improves the insulin sensitivity and also the insulin requirement, leading to reduced dosage of insulin or oral hypoglycemic agents, especially in type 2 diabetes mellitus. People, attainment and maintenance of ideal body weight. Reduce the coronary risk factor, favorable changes in body composition, also lowers the cardiovascular and overall mortality. It also gives you more energy and build muscle. it doesn't need to be strenuous in order to be effective. Like the recommendation dose is usually 30 minutes of activity per day, which is broken into 10-minute increment. Make exercise a less daunting task to incorporate into one's daily lifestyle, which is according to the American Council of Sports Medicine 2007. Also, sustained improvement in glycemic control when they maintain a regular plan of exercise, and the results are less conclusive in people with type 1 diabetes. So exercise is important in both type of diabetes. Its effect on blood glucose control is more pronounced in people with type 2 diabetes. Thank you.